Good day, my name is Caryl Comaya. I studied nurse from base in 2A and now I will going to perform return demonstration about Leopold'S maneuver. Before we proceed to our assessment, we need to identify first the client by asking her name. After that, we're going to introduce ourselves and state the purpose of the intervention. Ma'am, pwede ba kung mga tanong ma'am kung okay ra sa imo ha? Kano sa kitong first day sa last ni mga regla?
February 10,
O kano sa ka last na pa-check up?
August 30.
Ma'am, o lang to. O karon ma'am, kuhaan ka na ko og BP o okay ra sa imo ha?
Okay.
Maayong adlaw ma'am, pwede ba na ako makuha imong pangalan?
Ako dahil si Emily Payaw.
Ug ako day ang imong student nurse karon nga si Caryl Comaya. Inya, kumusta ma'am?
Okay lang.
Salamat day kayo ma'am sa imong pag-anhi diri para sa paggamit sa amuang serbisyo. Ug karon ma'am, aduna kitay paghimuon nga assessment na ginatawag og Leopold'S maneuver. Mao ning pamaagi para ma-monitor ang fetal heart tone para ma-check ang rate of rhythm sa heartbeat sa bata ug para ma-monitor ang kung how much nagabago-bago ang heart rate sa bata ug para matanaw nato kung aduna bay pagtaas ug pagbaba sa heartbeat sa bata. Before we proceed to our assessment, we need to make sure that our equipment are already prepared. I have here a stethoscope and the bed for patient is already prepared. After introducing ourselves and state the purpose of the intervention, we need to provide our client privacy by closing the windows and closing the door. For now, we need to wash our hands to prevent the spread of harmful microorganisms. After washing our hands, we need to encourage our client to enter her bladder because a full bladder makes her uncomfortable during assessment. Ma'am, kanang gibati ba kag kahian karon ma'am? Kay kung gibati kag kahion ma'am, pwede pa ka manghi dito ma'am.
Wala man, sir.
Okay? Proceed na ta sa ato ang assessment ug pagbuhaton ma'am. Ma'am, pwede pa na ako buklason ng imong t-shirt, ma'am? Kuto lang sa imong kuto-kuto.
Okay ra, sir.
We need to make sure that the other part should be covered and we're going to expose only the abdomen. Before we going to palpate the abdomen of the mother, we need to warm our hands because cold hands may irritate the uterus causing it to contact, making palpation difficult. So ma'am, ako nang gunita ng imong tiyan mama. Okay lang ba sa imo?
Okay ra.
And now we're going to perform the first maneuver. Face the head part of the client, while facing the woman. Place the hand on the top of the uterus and palpate the superior surface of the fundus. Determine consistency, shape, and mobility. The purpose of this is to determine the location of the fetal head and fetal buttocks and use this when measuring the fundal heights. And now we're going to perform the second maneuver, the umbilical grip. Still facing the woman, put both hands on either side of the abdomen, applying gentle but deep pressure. Place on the hand stabilizes the one side of the uterus. The other hand palpates the opposite side to identify the location of the back and small part. Palpation begins in the midline and continues down the side of uterus. The other side of the uterus is stabilized and pulpit applying gentle but deep pressure. Repeat the same procedure on opposite side. The purpose of that is to determine the location of the fetal back. And now, we're going to use our stethoscope and place the diaphragm where the fetal back is located. Count the number of the heartbeat in 1 whole minute. And now we're going to perform the third maneuver, the Pollick's grip. While facing the woman, cross the lower uterine segment between the thumbs and the finger of one hand just above the symphysis pubis. Press in slightly using the thumbs and the finger. Make gentle movement from side to side. Pay close attention to the size, color, and consistency of the presenting part. The purpose of that is to determine what fetal part is laying above on the fetal or lower abdomen. And now we're going to perform the fourth maneuver, the pelvic grip. Face the client, foot part, place palm on the sides of the abdomen just above the inguinal ligament. So, grab the snugly the lower abdomen with the outstretched thumbs, meeting at the umbilical level. Place the finger on both sides of uterus approximately 2 inches above and inguinal ligaments, facing downward and inward in the direction of the birth canal. The purpose of this is to locate the fetal brow. After that, wash your hands to prevent the spread of microorganisms. Document the client finding.